At Eye Excellence, we're a full-service practice, caring for everything from routine exams and contact lenses, cataracts, corneal surgery, LASIK, to screening and care of glaucoma patients and diabetic patients. We try to combine the newest technology with old-fashioned caring.
Welcome to Eye Excellence, Houston's most trusted name in vision correction for over 20 years. Our goal is to combine leading-edge technology with old-fashioned care. We put our reputation and experience on the line every day, as we are totally dedicated to forever changing the way you see your world and the way the world sees you.
I would say that I have complete confidence in the staff and would highly recommend anyone, if they're going to have something done to their eyes, come here, because everyone I've worked with and had work on me has been excellent, and I give them a 100% rating on every one of them. And Dr. Green is just par excellence. She's just great. I think she chose the right name, Eye Excellence, because she believes in it.
Eye Excellence is a full care facility capable of taking care of all your eye care needs. Specializing in refractive and cataract surgery, we offer a number of state-of-the-art procedures to help our patients reduce or eliminate their dependence on glasses or contact lenses. Which procedure is right for you depends on your age, your occupational and lifestyle needs, and the condition and health of your eyes. Therefore, your first visit to Eye Excellence will involve having a complete medical exam by our competent staff of doctors and certified ophthalmic technicians. With this information, Dr. Green will make a vision correction recommendation. The three most common procedures we perform at Eye Excellence are eye LASIK, laser vision correction, implantable contact lenses, and presbyopia correcting intraocular lens implantation. Eye LASIK is laser vision correction at its finest. Doctors have been doing LASIK for over a decade, with over 32 million procedures performed to date, making it the most common elective vision correction procedure in the United States. Eye LASIK combines the unsurpassed safety of the intralase femtosecond laser that makes the corneal flap, with the accuracy and precision of the VisX Star S4 IR excimer laser that reshapes the corneal tissue.
The best things in life are custom, whether it's a fine suit or perfectly fitting pair of jeans. And now, Eye LASIK brings that fitting to each of your eyes.
I found the Eye Excellence Center through a Google search. So I actually am not from Houston. I was doing a little bit of research, looked on Yelp, looked on all sorts of avenues, and I saw some pretty solid reviews for Eye Excellence. And so, having looked up Eye Excellence, having done my research on Dr. Green, I realized I think I trust this place. I started wearing glasses in the 3rd grade on an on and off basis. It was something I wasn't very proud to be wearing. Started the contacts in high school, and from high school onwards, I've steadily worn them, and it's gotten progressively more difficult. The staff was very friendly, very welcoming. They definitely sensed a little bit of hesitation, and my nerves were very racked coming into the idea of doing LASIK, but they were very welcoming. They talked me through everything, A to Z, what to expect during the procedure, and so that definitely helped sway my decision to go forward with the LASIK. The day of the procedure was a little nerve-wracking, but it was good. I came in, they had a very solid schedule laid out. They had me sit here, I had snacks, I had stuff to keep me calm and going for a while, and then going into the procedure, of course, it was very structured, very organized. It was everything I was, talked through and expecting. The next morning was interesting. I stepped outside on my way to come to the doctor for my follow-up, and I literally could see everything. Life after LASIK, it's been great. It's been a whole change of routine for me, waking up in the morning, literally just washing my face, getting ready and going. There's no extra step where I'm taking to rinse out my lenses and put them in and blink repeatedly in an attempt to see if they'll hold or not. So it's a very nice change of pace for me to have had the LASIK.
My life before LASIK, it was pretty much I started wearing glasses in 4th grade. I started squinting because I couldn't see things from far away.
I've actually worn glasses since I was in kindergarten. I don't really remember ever waking up and being able to see So ever since I was a little kid, my parents, apparently I walked into walls. That's how they knew I didn't know how to see.
The whole experience of LASIK, it was kind of nerve-wracking at first, but since my brother-in-law did it, he kind of like talked me through it. It's like, oh, it's not so bad. And Steven was like, don't be nervous, it's nothing.
I was actually in the laser suite for a total of a few minutes. The whole procedure itself, getting prepped and everything, probably a total of 10. The next morning after the procedure, I was able to see 20/20. Actually, that evening, I was able to see perfectly. No pain, no problems really.
When I woke up the next morning, it was amazing. I was able to see everything, and I thought I needed my glasses. I reached for it, but I just realized, I can see. I didn't need it. So it was awesome. It was a great experience.
I knew I wanted to get it done, but since my sister was more blind than I was, I pretty much convinced her, dragged her along with me. She came, I called Steven up and I scheduled the consult with her. We did the pre-op. We actually scheduled surgery for the same day also.
And I owe you big time.
The first step in having eye LASIK involves a series of tests to determine the individual characteristics of your eye using WaveScan technology. The WaveScan system creates a 3D map documenting the unique imperfections of your eyes. This digital information will be used to design a personalized laser treatment for each of your eyes. Our laser suite is located within our medical offices on the 21st floor of the St. Luke's Medical Towers. You will arrive about an hour before your scheduled procedure. Information about your eyes will be reconfirmed, and then your eyes will be completely numbed with eye drop anesthesia. Next, using the intralace femtosecond laser, Dr. Green creates a thin, blade-free flap of tissue. In addition to making LASIK a safer procedure, the intralace laser allows Dr. Green to customize the size, thickness, and orientation of the flap for each eye. Clinical results have demonstrated that more patients achieve vision that is 20/20 or better when the intralace method is used. Then, using the WaveScan 3D map as a guide for the VisX Star S4 laser, the eye is gently reshaped using the cool light of the excimer laser. The VisX Star S4 laser is equipped with a 3D active eye tracker, which follows the tiniest motion of the eye instantaneously in all 3 dimensions. It automatically repositions the laser to keep the laser focused where Dr. Green wants it focused. If your eye makes too large a movement, it automatically shuts off the laser until your eye is back in position. After the laser reshapes the cornea, the flap is gently folded back into its original position, where it bonds without the need for stitches. Many patients experience a dramatic improvement in their vision immediately after the procedure. Most people return to their normal activities within a day or 2.
These days, eyesight-wise, I'm much better equipped to deal with any kind of emergency like that. And the other kind of big upside for me is that I can have any choice of sunglasses that I want, whereas before I had one prescription pair and that was it. These days, I can be much more fashionable.
Although eye LASIK has demonstrated its ability to consistently provide patients who are nearsighted, farsighted, and have astigmatism with 20/20 or better vision, eye LASIK is not for everyone. For many patients who learn they are not candidates for LASIK while visiting practices that only do LASIK, the implantable contact lens, commonly called the ICL, can offer new hope.
About 4 years ago, I tried to get LASIK vision and was told I wasn't a candidate, and was told to wait a couple years, that new technologies were always developing. And so this last time when I learned that I had to wear glasses, I asked what the new technologies were, and was told that LASIK had been refined a little bit and I might be a candidate now. And then there was also this procedure called ICL, and was recommended to Dr. Green, and I went in and did the test for LASIK once again, and found out that once again I wasn't a candidate. I had real thin corneas, and for a person with the correction of mine, you want, I guess, thicker corneas to get LASIK with. So I was told that ICL was a possibility, and was given paperwork and videos on it, and read through everything, read about Dr. Green, and you know what a great surgeon she was for cataracts and other eye surgeries, and decided to go for it.
I think individuals that have a very high prescription, what we call a heavy prescription, in their glasses are better served by the implantable contact lens than laser, because I think they can achieve a better quality of vision.
Because the procedure involves operating inside the eye, it will be performed at an ambulatory surgery center as an extra safety measure to minimize any remote chance of infection. The ICL is a small injectable lens inserted through a tiny 3mm incision. Once it unfolds within the eye, it's tucked in behind the iris, or colored part of the eye, where it rests in front of the eye's natural lens.
This procedure is absolutely reversible. The implantable contact lens simply floats over the patient's native lens, and it can be easily reversed if there should be need for a change in power due to some unpredictable factor, or once the patient ages and develops cataracts.
The ICL procedure involves having one eye done at a time, with the second eye usually done within a week or so. The full benefit after having both eyes corrected with ICLs can be really exciting for those patients who have been so handicapped by their vision for so long.
I've been a satisfied customer since the day after surgery. I would never go back to contacts or glasses. I am fully satisfied, and I just can't imagine my life now without anything except for the ICL and good vision without corrective lenses.
Eye LASIK and the implantable contact lens are generally excellent tools for correcting vision for patients in the 20 to 40 age range. But after the age of 40, most people, whether they are normal-sighted, nearsighted, or farsighted, experience a condition called presbyopia. Around this time, the eye's natural lens begins to gradually thicken and harden, making it difficult for the muscles in the eye to focus the lens. This is known as loss of accommodation, and its earliest symptom is difficulty seeing things up close. Over time, it also impacts one's ability to see intermediate images, distant images, and all the images in between. Eventually, the natural lens may become more dysfunctional and develop a cataract, which interferes with its ability to pass light rays to the retina. Once a cataract forms, the only way to see clearly again is to remove the dysfunctional lens and replace it with a clear intraocular lens implant, or IOL. Until recently, most patients received fixed focus IOLs that could provide good vision at only one distance, and usually means wearing reading glasses to read.
In my opinion, nearly everyone is a good candidate for these lenses. Right now in our practice, most people having cataract surgery choose one of these lenses. These lenses are for every function in every day of your life. It's wonderful to just get up, see the clock, get dressed, do whatever it is you want to do that day and not worry about finding your eyeglasses.
Unlike the implantable contact lens implant that is added to the eye, intraocular lens implants replace the eye's natural lens inside the eye. But like implantable contact lenses, the procedure will be performed on an outpatient basis at an ambulatory surgery center, one eye at a time. There are several types of presbyopia-correcting IOLs available for our patients. These include both accommodating IOLs and multifocal IOLs. The accommodating IOL, known as crystal lens, is the first lens that attempts to mimic the movement of the eye's natural lens. This was accomplished by creating an extremely flexible lens, which allows the optic to make microscopic movements move back and forth within the eye. When the eye muscles contract, the lens moves forward to focus on near objects. To go from near to intermediate vision, the muscle must slightly relax to move the lens backwards. When the muscle is totally relaxed, the lens is all the way back to allow clear distance vision. Multifocal IOLs, such as the Rezoom and Restore IOLs, work by dividing light into several focal points, leaving it up to the brain to choose when it wants to see the near, intermediate, or distant image. Dr. Green will want to visit with you to determine which presbyopic IOL might be best for you.
Dr. Green informed me several years ago that I had cataracts, and just the mere thought of having any kind of surgery on my eyes was major for me, because your vision affects every aspect of your life.
I noticed that the cataracts were causing colors around me to seem like I was looking through a pair of sunglasses, and the colors weren't as bright, and my vision was getting to the point that things were getting blurry. And when Dr. Green said, it's time to do this, then I said, whatever your schedule is, suits me fine, let's do it.
Dr. Green is the one that helped me to make the selection of the crystal lens for my eyes, because what is so important to me was my up-close vision. I thoroughly enjoy doing beading as well as crochet work, which requires proper stitches.
With Dr. Green's expertise, she explains things so simply and so easily, and all I had to do was follow her directions. And yeah, I had a little apprehension because needles, knives, and doctors make me very nervous, but she made it very easy. She made it easy, the whole procedure, after, before, and it was no big deal. I would recommend Dr. Green, and do recommend Dr. Green to every person I know. It's her expertise, her compassion, just the way she treats her patients, and it is absolutely the truth. She cares about every person she sees.
My husband loves to travel. We come and we go. People update their kitchens. They send their children off to college, and all those things are very important. But your vision is a lifelong gift. It won't grow old. It won't need updating. You can buy a larger flat screen TV, a smaller, more up-to-date cell phone, but your gift of vision with Dr. Green is lifelong.
We have a lifestyle form that I have each patient fill out, and based on the answers that they give me on that form, plus the measurements that we do, putting these two things together, I can decide which of all the lenses available are going to be best for that particular patient.
It's very seldom that you can get it exactly perfect in terms of the balance of seeing long distance and being able to read up close. But what Mary did, I wouldn't call it a miracle, because I just think she's very good at what she does. And what she did is listen to me, listen to my needs, listen to my concerns. I didn't want to have reading glasses if I could help it, but I also wanted to be able to see, to drive again, so you have to see far away. So we spent a lot of time talking about some solutions, and one of the solutions was to put a monotype lens in one eye and the other kind of lens, a crystal lens, in the other eye, and it's given me perfect vision.
Whether you are a good candidate for eye LASIK, implantable contact lenses, or presbyopic intraocular lenses, it is important to remember that it is surgery. Although the chances of very remote complications can occur, and your individual results cannot be guaranteed.
The cataract surgery and these refractive surgeries have a very low risk rate, but they're not without some risk. With cataracts, 98% of people see better than they did going in, and I think for anything surgical, those are excellent statistics.
She explained to me the whole process, and Dr. Green was very patient and telling me all the advantage, and of course a little bit of a side effects, because nothing is perfect, and gave me all the options about it, and gave me time to think about it, and so I make the decision that I think it was the best for me, and I'm very happy about the surgery. Dr. Green has a very steady hand when she does the surgery.
I had always heard that the cataract surgery was done while the patient was awake, and the idea of eye surgery while being awake was very frightening to me. As it turned out, I did not remember anything of the surgery. I remember going into the room for surgery, but if I was awake, it wasn't something that I was conscious of.
Thanks to the many advances in surgical technique and vision correction technology, there has never been a better time to have your vision corrected.
As far as the question of should I wait for something new to come down the pipeline, I would say, would you have waited to buy a cell phone or a computer? An example is Microsoft Word. They're going to have extra bells and whistles added onto that, but the basic technology is there now. I would want to go ahead and enjoy what's available right now. You may have a cataract, you're not seeing well, you've stopped driving at night because you don't feel comfortable, so what are you waiting for?
She first did LASIK surgery to correct my vision. Following that, several years, we ended up with diagnosing cataracts. And when we looked at that, because of my work and the need to do both close work and computer work, and to be able to drive to and from work, we ended up doing the multifocal lenses. So now I can see to drive, see to work on with the computer, and also work close hand with any numbers, figures, or data that I need to see. It's worked well for me. Dr. Green's done a fantastic job of taking care of my vision.
Vision affects almost every aspect of your daily life. And what could be more rewarding than helping people improve their vision? That's why I love doing ophthalmology.
Seeing to me is pretty important. And I think we all want to be able to focus in on life, and it's a very, very precious thing that we have, the ability to see. And now that I see in HD, you know, it's very exciting. The colors, it's wonderful, and being able to focus in and read. So for me, this is the best experience I have ever had.
If the idea of living a lens-free lifestyle is something you've always dreamed of, be sure to ask Dr. Green or a member of our staff if you might be a candidate for one of these exciting vision correction procedures. Thank you for your faith and confidence in eye excellence, Houston's most trusted name in vision correction. We'll be with you in a moment.
I first started wearing glasses in 2nd grade, and I was the first kid in my class to wear glasses. I wore glasses for probably, 12 years or so, and then started wearing contacts, and then actually in the last 5 years had a lot of problems with my eyes where it would get irritated, and it was caused by wearing the contacts. So Dr. Chever was the one that has been telling me for the last 5 years that LASIK would be the kind of the thing that would help me in the end. I think going into it, I was really nervous, I guess. The morning after LASIK, I woke up and I just couldn't believe I could see so easily. It was unbelievable.
Hello, I'm Dr. Green. America has a great military to preserve and protect our country and everything we hold dear. It gives me great comfort knowing technology is helping these brave men and women do their jobs with great confidence under all conditions. The men and women who serve our country make great sacrifices, especially during long deployment overseas. As a doctor, I'm proud of the contributions that physicians have made to the performance and safety of our military and first responders. To all of our servicemen and women and to all of their families, I offer my profound thanks.
It's not science fiction, it's now. This is today's Army, Air Force,
3 miles now.
Navy, Marine Corps. Together, they're the most advanced fighting force on the planet and beyond. The biggest advantage in combat has always been to be able to see your enemy before he sees you. Today, that means orbiting surveillance satellites capable of reading the license number on a vehicle 500 miles below. Or goggles that can amplify the light of a star thousands of times and turn night into day.
Tight formation coming in.
It means a pilot sitting in a control room in New Mexico can track down an enemy on the other side of the world, and if necessary,
Lock up target 5.
eliminate them.
2, 1, impact.
New technologies have enormously enhanced our ability to see the enemy first. But these are all just extensions of the human eye, and they are all subject to its limitations.
Right now, 45% of everyone in the Air Force is nearsighted and needs corrective lenses in order to do their job. Perfect.
Colonel Charles Riley is an ophthalmic surgeon and consultant to the Air Force Surgeon General for refractive surgery.
We're looking at enhancing the human weapons system.
Over the past decade, Dr. Riley and other military surgeons have been using laser vision correction to enhance the vision of hundreds of thousands of soldiers, sailors, and airmen.
Never saw that before without glasses. We talk about upgrading our avionics in an airplane so they can see out further, see the bad guys sooner. Well, that's what we're doing with our laser for the human weapon system. The most important weapon system in the cockpit is that human. And so to be able to offer them that upgrade in their avionics is priceless. It really is priceless.
It may mean the difference between them living or dying in their job. It's that big.
Commander Elizabeth Hoffmeister is a Navy flight surgeon. She was involved in some of the original studies that led to the military's approval of laser refractive surgery.
In the military, we do not consider LASIK to be a cosmetic procedure at all. It is truly a warfighter, almost like a gear issue.
When we send a soldier off for deployment, that's one of the things that we as commanders have to do. We have to make sure that they are well trained, well equipped. If we can make him better and he is qualified for corrective surgery for his eyes, let's do it.
General Frank Helmick is commanding general of the Army's 18th Airborne, the Rapid Deployment Force, and the deputy commanding general of U.S. forces in Iraq. He's had LASIK surgery himself.
And our military has an advantage over our adversaries in almost everything, I think. And LASIK surgery is just another indication of that.
LASIK was approved by the FDA for refractive surgery in 1998. But it was more than a decade before the procedure was accepted by the military for aviators. It wasn't a question of effectiveness. In the civilian world, LASIK had amassed a long and enviable track record for safety and consistently good vision correction.
If something performs well in suburban America, that may not perform well in the middle of the heat in Afghanistan. May not perform well at 25,000 feet jumping out of a plane, may not perform well under water with explosives and concussive effects with the water, which is not necessarily something that's tested very well on the civilian side.
Colonel Scott Barnes, an Army ophthalmic surgeon, was intrigued by the potential for the Army's Special Forces. He began testing laser refractive surgery under extreme conditions with soldiers at the Special Operations Command at Fort Bragg.
I want to make sure that I know that I've given him the best opportunity, that we, as the Army, have given him the best opportunity. And unless we've done that study ourselves, I mean, it's kind of Ronald Reagan's mantra of trust but verify. We believe that most of those things are probably correct. We just want to see it for ourselves.
I was pleasantly surprised. Pleasant is perhaps not a strong enough word. It was amazing how well folks did that in all the environmental studies that we looked at.
Dr. Steve Schallhorn is considered to be the founder of the military's refractive surgery program. As a former Navy Top Gun pilot, instructor, and ophthalmologist, Schalhorn was in an ideal position to see the potential and the problems.
Before we'd even consider doing something that could affect their vision, we want to make sure that procedure is safe and effective. It's in all of our interest to do that. And that's why we spent years and years, study after study, looking at how safe and effective this is in the environment that our folks have to go into.
He spent nearly 10 years putting laser eye surgery through every test he could come up with.
We looked at performance before and after we did laser vision correction. And what did we find? Better performance after laser vision correction. Well, better is a good thing, and that's why I was like, dude, this is pretty darn awesome. And all the studies lined up very similar to that.
The results that we've been seeing with our aviation study have been phenomenal.
Captain David Tanzer, also a Navy eye surgeon, worked with Schalhorn on a number of studies, concentrating on naval aviators. In 2004, he began testing wavefront analysis, a new diagnostic technology. Wavefront could identify the slightest flaws in the eye's optics and then guide a laser to correct each of those defects. With the addition of wavefront analysis, Captain Tanzer and other military researchers found LASIK could routinely produce supervision well beyond what's considered normal.
It's not 2020, it's not even 2016, it's 2012. It's 2 lines better than 2020. 92% are 2012 or better uncorrected, and 35% are 2010. They max out our eye chart.
In 2006, after nearly 14 years of countless studies, tests, and trials, Steve Schalhorn was finally satisfied.
Looks good, Paul, looks real good. On that point, then we said, this is good enough for aviators now. We had done the environmental studies. We had obviously very intense, many studies looking at this quality of vision aspect, looking at modern technology, and then we decided it's good enough for aviators. At that point, we started LASIK in aviation.
That opened the door for LASIK in space. NASA, which until then had banned any type of refractive surgery, approved LASIK for their astronauts.
And that represents a real milestone. NASA looked at the safety and effectiveness of LASIK in great detail over the years, and they have deemed it safe and effective for use in their astronauts. We should take great comfort in that, in knowing that it has reached that level.
Presbyopia means your arms are too short. Actually, the lens in your eye is getting stiffer and it's unable to focus like you used to focus. So if you want to read something, you're needing reading glasses. Presbyopia usually occurs in patients, or they notice it once they hit mid-40s. It's much more pronounced by age 50. It actually starts back in your 30s, you're just not aware of it. A cataract is simply a fogging of your natural lens. What I mean by that is this. If you could see inside of an eye, this orange is retina. That's where the visual cells are. That's what allows you to see. This is lens here. That's what gets a cataract. We all start with a clear one, like a window, but as you get a cataract, this lens becomes yellowed, discolored, and foggy. When we fix a cataract, we're simply taking the foggy lens out and replacing it with a clear artificial lens. All that done through a microscopic opening. The major symptoms of a cataract are difficulty seeing in the dark. You feel like you just don't see well in the dark anymore. Problems being uncomfortable driving at night, increasing glare from headlights or any kind of light at night. And you see distance, but it's just not as crisp as it used to be, regardless of the pair of glasses, even if they're brand new. Typically, patients with cataracts go through many pairs of glasses, blaming it on the glasses are no good. It's not the problem of the glasses, it's a problem of the lens. Cataract surgery is performed as an outpatient procedure, simply using topical numbing drops. You do get sedative in your vein, so you really don't care, you're not aware of much. The procedure takes 20 to 30 minutes. You'd be at the facility where it's performed an hour or two. You do need someone to drive you home simply because you've had the sedative. But some people go out to dinner the night after they've had cataract surgery. You should be able to drive the next day. Many people come to see us for their post-op day 1 visit and go on to work. So in general, visual recovery is fast. There's actually great news for cataract patients. You used to have no choice. Now you do have a choice about the lens that's implanted in your eye. Lifestyle lenses actually give you more, allowing you to see far, intermediate, and near. The problem is they're not perfect, but they're better than your current situation. Lifestyle lens can potentially reduce or even maybe eliminate your need for eyeglasses, giving you a great deal more freedom.
Specialty contact lenses are designed for irregular corneas such as diseased corneas like those with keratoconus, also post-surgical corneas. Basically, those patients whose vision can't be corrected with a simple pair of glasses or contact lenses. Specialty contact lenses provide a smooth surface to the front of the eye, allowing for the best possible vision. Those are candidates, anyone who hasn't been successful with previous soft contact lenses, those who have high amounts of astigmatism, or those with distorted corneas due to disease. Also those who have had corneal transplants. The different type of specialty contact lenses, there's a smaller corneal rigid gas permeable lenses, which are the standard lenses types that's been around for many years. These lenses are also known as hard contact lenses. They come in many different designs in order to correct for a variety of eye conditions. There's also the hybrid contact lens, which is a soft contact lens, basically a hard contact lens actually surrounded by a soft skirt. Its claim to fame is a vision of a hard lens with the comfort of a soft. I'm most excited about the scleral contact lens. It's the ultimate lens for advanced cases. It's made a comeback with a new development of newer materials, better lens designs. It's a large lens, typically 15 to 18 millimeters in diameter. Although it sounds like a lens that would be uncomfortable, patients are surprisingly happy and successful with this lens.
A pterygium is a fleshy growth that occurs on the white part of the eye, most commonly in the nasal part of the eye, but it can also occur in the temporal part. It occurs in that part of the eye that is exposed to the air. In other words, if your eyes are open, you're going to constantly have air and sunlight hitting your eye. So it's sort of a cumulative process of exposure to the UV part of natural sunlight over a lifetime, and it causes an abnormal growth to occur. The best thing that patients can do to prevent pterygia is to wear a good pair of sunglasses.
Glaucoma refers to a group of eye conditions that lead to damage of the optic nerve. In most cases, damage to the optic nerve is due to an increased pressure in the eye. A damaged nerve translates to blindness. There are many fibers in the optic nerve, and in most cases, the pressure in the eye is not enough to kill the entire nerve at one time. But individual fibers die slowly and painlessly over time. It is possible to lose sections of your visual field before you completely lose the vision in that eye without even being aware of ongoing damage. Losing individual fibers in the optic nerve is a permanent condition. We cannot bring it back.
You may sometimes see small grayish specks or clouds moving in your field of vision. As you look at a white wall or a clear blue sky, they are known as floaters. Floaters appear in different shapes. They're like dots, circles, cobwebs, wiggly lines, or floating bugs. Floaters can be very bothersome. Most floaters will eventually go away, but this process may take several months to occur.
Hi, my name is Catherine Leung. I'm one of the pediatric hematologist-oncologists here in Houston at Texas Children's Hospital. I subspecialize in stem cell transplant for kids with cancer and blood disorders. I actually started wearing glasses when I was 7. Through school screening, my parents realized that I couldn't really see very well. Ever since then, I wore glasses up to the age of 16 when I switched to contacts. I am very impressed with Dr. Green. When I first came to the clinic, I knew that she listened very well to her patients. Whatever decision is made about whatever corrective therapy for the patient, she tries to make sure that it's tailored to their lifestyle. Before I had terrible vision. In fact, my prescription was about -17 at the time, and I believe that that's close to being legally blind, if not that. So, everywhere I go, I couldn't see without some sort of corrective lenses. And so since I've had my procedure, what's great about it is that I wake up, I open my eyes, and I can see everything. I would definitely recommend my friends, families, and even patients to Dr. Green.
This is good.
I came in about 15 years ago to Dr. Green and said I wanted to have the LASIK surgery. I was tired of messing with all this. And she looked at me and examined me. She said, no, I'm not doing 2 surgeries on you. You have the beginning of cataracts, and I'm not doing 2 surgeries, which really gave me I'd always liked her, but I really respected her even more, because I do think there are people out there that would have been advantageous enough to try to do 2 surgeries and, get the funds for it. So I really respected that. The surgery was really an easy procedure. I didn't have any dread with it. I had walked my husband through it less than 10 years ago. And then Stephen has been a special friend here for so many years, and he was there checking on me all the time. So that was extra comfort as well. Not only would I recommend people to Dr. Green for cataract surgery, I have recommended numerous people to Dr. Green for cataract surgery, and enjoy the fact that they've all had nice results and are very pleased with Dr. Green in this facility.